Is it that they're afraid of rejection? They laugh at them? So she passed experimental. She finally got her college degree, and her dream was to go to Florida and live there in the sun and swim, which she did, and she got a job, and I would communicate with her by phone, by letter, and I sent a Christmas card one year, and her mother called me a month later and said she was hospitalized and she hung herself.
Terrible. Awful.
I know. So this just being alone, not being able to reach out.
Yeah, I mean, and sometimes you look and there aren't easy answers to find. It seems mysterious, and sometimes you can't find answers.
Excuse me.
Sure.
We have a caller?
Hello?
Yes.
Hello? Hi, my name is Layla, and I have a couple of questions. I'm a college recruiter, so I'm seeing high school students as they go to these fairs, and my first question is, if you've identified kids at the school, having, being suicidal or having the thoughts about that, are they being seen or treated or dealt with at the school, or is this something where they're pulled out of the school and it's a separate program somewhere else at like a facility?
In our program, and this again was in Boston, we really wanted to provide as much care as we could in the school. I think school-based care is really important. It kind of deals with barriers that you often get into when people have to go way far from where they usually are to seek help and get treatment. We would refer sometimes, we would try and have a close network of treaters that we can refer to. We, within this program, define certain levels of risk of harm, and so we tried to handle as much as we could within the school setting, but some kids that needed pretty intensive treatment, given their level of risk, we would refer to specialty programs.
Wow, sounds like you guys are doing a great job there. So another question is, if they're, at a point where they can go to college, I mean, does the help or the support follow them to college?
Yeah, that's a really important question, and what happens is, and it's relatively well known in the field of child mental health, that the transition into adulthood it could be a pretty risky time. Often supports you have, during childhood, teen years, you kind of lose them as you go to college or into the workplace, and so it could be a pretty risky time. But part of it is within whichever environment you're in, and in the college environment, is to really try and have a network of supports, and to really within the college health system, even to have ways of screening, ways of destigmatizing mental health problems, so that people will seek out help. Lots of things to do, but it is a risky time for sure.
Well, we do have some help for students on all levels, and it includes mental health. So hopefully, if any students were to come to us, and since they've been in, maybe if they were in a program like that you've put together, they'll be more comfortable talking about it, and they will address that or bring that to our attention as soon as they become a student at our college. So I'm wishing that your program was everywhere.
Okay, thank you.
And so because it sounds like you're doing a great job, and kudos on you and your staff on that, and much appreciated. And I hope that you continue to have success in that.
Thank you.
Thank you. Yeah, a lot has to do with the environment, especially for young adults today. I had a panelist on my show. She was a graduate of an Ivy League school, very bright. Came out of college thinking that the job would be right there. Very disillusioned, very disappointed, extremely depressed, crying, going to her bedroom, along with other colleagues of hers. So young adults today are and they think about their future, pensions, and the world is turning upside down for them. I mean, I have three grandchildren, and I wonder what it's going to be like for them. I have a question. I work for a psychiatric clinic as a therapist and a consultant and then a clinical director. I found that teachers would constantly call the therapist and say, do something with this person. They're crazy, they're sick. How did you get the cooperation of the schools? Were they desperate?
Well, when we went in...
The principal.
Yeah. Well, the principal is key, of course, because the principal has the authority within the school, and it's very important to be able to engage the principal. And part of it is, when we went in, I mean, one, there was a crisis within the school around the suicide cluster and epidemic. But over the years, we continually had to work with the school to demonstrate the value of what we were doing. Schools are under a lot of pressure, as you know, and issues of test scores and learning
Academics,
and
yeah.
all of that become really primary. And so it's hard sometimes to get on the radar screen of a principal and a faculty within a high school. But once you begin to make the connection between the kid who's really depressed and is not learning to their capacity, the issue of suicide being devastating for the community in the school, and if you can help a school see the impact of what you're doing, those are all things that become very important. But it's really important, in my experience, to try and speak the language of the school and really ally what you're trying to do with what the school sees as most important.
Okay. So your interviewers, whether they were psychologists or social workers, would do a psychosocial bio.
Yep.
What was the... my question really is, if there's suicide in the family, what's the probability of a youngster suiciding?
Well, I mean, there are risk factors for sure with families, and there's a genetic risk for depression and for impulsive suicidal behavior. But then there is also modeling and seeing parents who are coping with problems in certain ways. There's lots of ways that environments and the way communication around emotion and distress work with the family that gets transmitted across generations. And so it's a complex question, but there's no doubt, for lots of reasons, there's risk in families that get transmitted.
So you don't feel at all it might be genetic?
Well, I think there is a genetic component, but what goes into someone becoming suicidal is complex and determined by many, many factors.
Very good. Do you want to ask me anything?
Well, what do you think about what some of the, in your experience with suicidal kids or adults, the type of feelings they cope with that really puts them at risk?
There isn't a real relationship. In fact, it's been researched that the relationship with the therapist or the counselor is the most important element. Forget about theory or anything else. So it's important to be good at engagement. I've been successful doing that. For me, it's a gift. But yeah, the relationship that's created with, also the relationship that's created with the parent, if you can get through it, and the relationship between the peers.
But I agree with you. I mean, one of the primary things about the power of therapy is to help someone feel not alone.
That's right.
And being attuned enough with someone and what their life is like, what they're contending with, is really powerful. And again, as I said, feeling alone is a primary thing that puts someone into a suicidal state, and that's why I think therapy could be so important.
Mm-hmm. I mean, I just an example, I had a clinic patient. He was African American, he was HIV, and he was gay. I mean, that's loaded deck.
Yep.
And for some reason, I put him on the couch, and we worked together for 2.5 years. He made amazing progress, very happy, picked himself up, made some friends, got his own apartment.
Well, life-changing.
But I really invested myself in this guy.
And people see when you invest in them, especially when they feel who invests in me, who around cares enough, it's very powerful.
Did you mentioned to me when we first talked, Glenn, about self-help groups, and it's like the model is AA, where you have your autonomy, there's support, you don't feel alone, there's somebody else who's going through the same thing. Was that built into your?
You know, it wasn't, and I don't have a lot of experience with it, but the principles are the same as those that I was talking about, for sure. Having people around you that really care and want to be with you, and
Yeah, make friends and.
Yep.
Okay. So what was the success rate that you had? Was there any results? And what was the significant factors?
Yeah, well, we did find that depression in a cohort of kids that had a certain level of depression, where we provided what we call a brief preventative intervention, that symptoms of depression diminished, as did suicidal thoughts. We also looked at the degree to which we were able to pick up kids at risk, and found that as the years of the program continued, we were able to identify more kids that were truly at risk, which I think was, for me, what the program was for, and was the biggest indicator of success for me.
Did age serve as a factor? We have a caller. You have a question?
Just keep listening. Yeah, how you doing, guys?
Okay.
I just want to thank you guys for speaking up about suicide and depression.
This could be a crank.
As a person that suffered from the depression part very heavily, and I attempted suicide a long time ago when I was a teenager. I could definitely identify with both those actions. And I'm sure that a lot of teenagers today suffer from one or the other. You're right, man. What's necessary to break free from depression and from the thoughts of suicide is support. Is support groups. So people like yourselves, is vital, is important that you guys continue doing what you're doing, because there's thousands, if not hundreds of thousands, if not millions of people that suffer from this. I'm a person who's still dealing with it, but have experience with it, so I know what I'm dealing with, and I just want to emphasize that it's important that you guys carry the message that you're carrying today, and let people know that, especially on the suicide part, let them know that it'll pass and that there's always another day. And that's what got me over the suicide part. I realized after a while that some days are good, some days are not. I mean, this may sound weird, but it was through other people that I realized I didn't want to kill myself anymore. Yeah. I saw the joy that my life could become through other people, and that's what prevented me from the thoughts, and eventually I got over it.
Thank you for...
that's all I want to say.
Well, no, thank you. What you're saying is very important, and there's a couple of things in there. One is, as we were talking about before, what you got from other people. But another thing that's a very important part of that, you were talking about hopefulness, that somehow what you got from other people instilled hope in you that things could be better than they are today when you're in the pits. And that's a very, very important thing, and I'm really glad you mentioned it.
Thank you. Is it easier to, I shouldn't say easier, but let's say the success rate working with a teenager versus a young adult, is there a real difference? You get jaded, isn't it?
I don't know. I mean, I don't know if there's data. There might be about that. I don't know. I think you have different sets of problems for sure. And I could see there's risk and resilience on both sides. So I don't really know whether one is a riskier group than the other.
Okay. Is teenage and young adults suicide different than adult suicide? Can you answer that? You don't have to.
Yeah, well, I think that, my experience has been mostly in high schools, and I think that, the peer group within teenage years is very, very important, and I think a little different than with adults, where suicide and suicidal thoughts become embedded within social groups and that type of thing, and I see that as a potential difference.
Okay, we have a caller.
Hello?
Hello?
Yes.
Thanks for
calling. I would like
calling.
to know what kind of experience you've had in your program with students who are feeling depressed about their sexuality, about not being accepted, coming out.
Yeah.
Maybe,
Being bullied.
Yeah. Well, we know that's a really, really great question, and we know that that's a risk for suicide and something that needs to be paid close attention to. It's consistent in a way with some of the things I was saying before about feeling alone, that if you are having feelings of being gay, feeling like you're the only one who has these feelings, feeling like everyone else is different than you, that you can't tell anyone, it's really a profoundly alone feeling. And then if you compound that by someone who's feeling really depressed and feeling like you can't really tell people you're depressed because of the stigma about that, it really sets things up for bad things, because you feel precluded from reaching out to get help.
Anything else? You care to ask anything else? Okay, thank you for calling.
Thank you.
How do we talk about shame, parental shame?
Yep.
It's a big...
Really important, and part of what we're talking about, whether you're a gay teenager and feeling ashamed, whether you're ashamed about being
You're Jewish?
your religion, Jewish,
black?
Yep, whatever it is, and feeling different, feeling like everyone else is the norm except you. It's one of the things that keeps people from seeking help, feeling like someone is worthy of help even. And it's this cycle of desperation, feeling distressed, alone, wanting to seek other people, even trying, and feeling like they're not attuned. It just builds on itself.
Mm-hmm. Mm-hmm. Well, you heard that there was a news article about a young boy who was gay and was bullied by a group of older students, and he went home and hung himself.
Yep.
So I would think that the sensitivity of the individual is extremely important. How much have they been protected, overprotected in the real world, or neglected by their parents as a factor?
Yeah. I mean, I think it's a culture of attunement. So you had mentioned a teenager.
You know, when I hear you say attunement, I'm thinking about infant parent attunement.
Well, it's similar. It's how attuned one person is to the emotional state of another, how aware you are about the distress of a loved one. If you're in a school and there's a child who's sitting in a corner looking out the window, not learning, or looking really sad, is there anyone to ask, are things okay?
That was me.
Okay, but really, you know, if there's a culture within a school or a community of caring, to seek out people, to see when someone might be distressed, not being intrusive, but being aware enough about what someone might be experiencing to ask. That could be very powerful to someone who is sitting there feeling completely alone, like no one cares.
I don't know what to do about the system. The system emphasizes grades. We've got 5 minutes.
Okay.
And the teachers focus on the good students.
Sorry. I have a question in from the audience, if that's okay.
Sure.
Out here. We want to know if there's a message out there that you guys could give the kids.
Yeah.
So like, you know, talk to them.
Okay. A message for the kids. There is hope. Seek each other out. If there's a kid who you know who is looking distressed, looking really sad, ask them what's going on to try and help. And if you're a kid who really feels alone, feels like what's going on inside of you is completely different, that no one can really help, I'd give people a chance. You're really not alone, and there are people who are suffering just like you in lots of ways. And the worst place that you can be is to be just sitting there alone at night, feeling like there's no one there for you. And there are people, and give people a chance, because that's how to get help.
You really the suicidal person really believes that there's nobody there.
It's true. It's very sad.
Nobody at all. It's very sad. And even if someone came, they find it very hard to believe.
Yep.
And they'd reject it.
And there's a certain courage and bravery a person who's feeling so alone needs. Feeling like there's no one there, no help, but to step forward to a friend, to a teacher, to a parent, to a sibling, to a priest, to someone. It takes bravery, but that's how people get help.
I know all about bravery.
Yep, of course.
Well, this is really very informative, and you've explained it in such clear language. And you mentioned to me you might be doing something on this line at the Child Study Center or the psychiatric?
Yeah. I mean, I'm relatively new to New York, only a few months, and part of what I'm trying to do is bring my programs here. I haven't done that with my peer suicide prevention program, but I would love to be doing that within New York. And I've really appreciated being here, and the audience had really spectacular questions, I thought.
Yeah, I'm surprised. Okay, we have to wrap it up.
Okay, well, thank you.
Thank you, Dr.
Thank you, Russell.
Thank you, Glenn. If you do something like that, I'd like to be involved somehow.
That would be terrific.
Yeah, I'll be better.
Yep, of course.
I got my angel over there looking after
great.
me. Okay. Any questions or comments? You can email me at Mr. Russell at cs.com. Do you want to mention your email? Do you want anyone emailing you?
Sure. Glenn, Saxe, S-A-X-E, at NYUMC.org.
Okay.